Guys, welcome back to Medical Coding with Blue. We all know what today is. It is the original Q&A Tuesday. So, I will start off this episode with the countdown days. So if you're new to my channel, I am counting down the days to the AHIMA 2019 conference that is being held in beautiful Chicago, Illinois this year, home of the American Health Information Management Association. Pre-conference starts on September 14th, and that is 81 days from today. And the official kickoff, when everybody gets in and they have this wonderful welcoming ceremony, which is on Sunday, September 15th, is 82 days from today. So, I'm very excited. So let me tell you how my day went. It was a trial of patience and a comedy of errors, because that's how I'm going to choose to look at it. So this is what happened. What had happened was, last month I have been trying to get my internet installed at my house, right? Okay, cool, no big deal. So this company does not give a solid time. They just tell you they will be here between 8 and 5. Okay, fine. So I'm at home and I'm waiting and I'm waiting and I'm waiting and nobody shows up. So I call, I'm like, where's this guy? He was supposed to be out. And he never came. They go, oh, yes, well, he says that he knocked on the door and he couldn't access you and, we're just going to have to reschedule. And I'm like, no, no, boo. I was at home the whole day waiting for this guy and he never showed up. They go, well, we're real sorry, we're just going to go ahead and send the tech out again. So I said, okay, fine. I said, let's schedule it for a few weeks. So I put in leave again. Okay, took leave again to be here for this install. So he's supposed to come today, right? So I'm waiting and I'm waiting, and I figured, okay, he'll be here in the morning. I can take care of a few things that I need to take care of, and it won't be a day wasted, and I will have a bunch done, because we all know how much I love productive days. I waited and waited and waited and waited, and guess who never showed up? So I called the people again, and I'm like, again, this is trying my patience, but I'm like, okay, just relax, maybe he's just held up somewhere. Okay, fine. So I call and I say, what's going on? You know what I mean? He's supposed to be here, and this guy is a no-show. You know what I mean? And it's almost the end of the day. Like, what's going on? And so then they say, oh, yeah, well, he came out there, but he checked the box, and the internet speed is too fast, so he has to get other different equipment. So we're just going to have to reschedule this again. And I go, this is going to be the third time that he comes out to install this internet. Yes, well, we're real sorry. We're going to take care of you. Don't worry. And I'm like, so next month, we're going to try this again. And I'm at this point where either I could do one or two things. I can either laugh or I can cry about it. I'm going to choose to laugh because I don't like to cry. And I'm just going to be like, whatever, man. Okay, so that was my day. Okay, and of course, I'm going to be loading this video late, so it's going to take forever to load, which is very annoying, because if I don't seem to load the video before a certain time, if I load it after, it just takes forever to upload. So if you guys are getting my videos really late, hopefully you've had that little notification bell whenever I do put out a new video. And so if you have that and it's really late, that's why. Anyway. So let's get to the questions. So thank you to everybody who submitted questions. I really appreciate it. You guys are helping to shape these episodes of Q&A Tuesday, the original Q&A Tuesday. So I really appreciate it, and thank you for being a part of it. Okay, so let's get started. The first question is, what documents are you looking at when you're coding in the outpatient setting? Is it just a record, the op report, or radiology reports? Okay. So when you are coding in the outpatient setting, we code based on the information that is given to us that day. So each encounter stands alone by itself. All like if it's an encounter for the 5th, whatever the provider's documented on the 5th, that is what we are coding from. So if you are coding from op reports, basically you're like a same-day surgery coder. You tend to want to learn how to read op reports. A lot of times the providers will start off the note with this patient had a laparoscopic appendectomy, just for example. And if you look at it and say, oh, laparoscopic appendectomy, okay, no big deal, I'll just go ahead and code this and then move on to the next one. Wrong. Because you have to read what the documented, right? Because if you just take off the top, oh, laparoscopic appendectomy, he may have thought he was going to do a laparoscopic appendectomy, but when he got in there, it had to be converted to open. So these things cause the codes to change. So you never want to just take the name of the surgery at face value. You want to be able to look and read through the op note to make sure that it matches up with whatever they said that they did. So, and if it doesn't, then you're going to code whatever is there. So be sure to keep that in mind when you're starting out. Pathology reports are used to find the definitive diagnosis. So sometimes if they're if they've done a surgery and you have to wait until the pathology report comes back, because sometimes a provider will remove something and they'll send it to pathology to see what is the makeup of this, what's going on with this patient. Is this benign? Is it malignant? Is it just a cyst? Is it what is it? This way you'll be able to pick up fully what happened. So it's always important to look at all of those things. Make sure that you're gathering all the information that you can based on what the provider is coding or what the provider is documenting for that day of service. So keep that in mind. All right. Number 2 is an explanation of the Z codes. Okay, so let's talk about these Z codes. I'm going to do an episode on these separately, so that way we can just kind of break it down. But just to talk about it, since this did come through on Q&A Tuesday questions. So with the Z codes, when you, let's just say, for example, that the patient had a arthroscopy, right? They had a knee arthroscopy for their osteoarthritis, okay? Obviously, osteoarthritis is not an injury, okay, because it has nothing to do with post-traumatic, okay? It's just plain knee osteoarthritis. They had an arthroscopy, right? They went in there and they cleaned it out and did what they did, okay? And they sewed the patient up. That is going to be orthopedic aftercare, right? Because that surgery has everything to do with an organic condition that happened to the patient. This has nothing to do with an injury, okay? So we're going to use that Z4789, right? Which is orthopedic aftercare, okay? You're going to use that Z4789, that aftercare following surgery, all through those, through the global period. So those 90 days post-global, okay? Anything in that 90-day global period is going to have that Z4789, okay? Unless there's something else going on, but this is just to illustrate a normal outcome, okay? If they had the surgery and they're in those 90 days, you're going to use that Z4789. Once they are out of that 90 days, right? Say they come back 6 months later, just for a follow-up to make sure everything's okay. Obviously, they're okay. Nothing else went wrong. So you can put in there Z09, which is the follow-up. That's when we're talking about a follow-up. Now, if you are, it is an injury, right? Say, for example, they fractured their patella. They had to have an open reduction internal fixation for the patella, okay? They did the surgery because they fractured the patella. You would use that fracture code all through that, and they had surgery for it, so they're in a 90-day global period. You would use that same fracture code all through those 90 days. So remember, where they have the initial treatment, that A, right? That 7th-digit character of A for that fracture is going to be on your first visit, okay? Or while they're actively being treated. So let's just say that they came in and they decided, well, this is an open fracture or whatever, and we're going to take you to surgery, okay? A for that visit, and then the next day they had surgery or whatever. Then after that surgery is going to be a D, okay? Because they're in their healing phase, okay? So that same fracture code is going to follow them that 90 days afterward, okay? Now, they get out of that 90-day global period and they come back 6 months later. They're just checking them out, making sure everything's okay. And they say, oh, yes, everything's fine. You've healed well. You've done physical therapy. Everything is great and good to go. So now we're looking at Z09 because it's a follow-up. There's nothing else going on with this patient. And then we're going to use a history of fracture code. Okay, this is why there are those codes for history, because obviously it's healed, the fracture's healed, and everything's good to go. You know, this is why you would use those codes. But you never use the follow-up codes while they're being, while they're in the post-op global or while they're being treated. You're going to use either the injury code or the aftercare, depending on what is going on with this patient. So I like to look at, well, how do you know if it's aftercare? How do you know if you use aftercare versus, an injury or whatever? If they are injured and they have surgery, you're going to carry that injury code all the way through until they complete their treatment or they get out of the global or whatever the case may be, okay? And only when they are healed out of the global period, then you would use the follow-up codes with the history codes. So hopefully that makes sense, because I know it's kind of hard, especially because I'm kind of darting here, darting there. But I will do an episode on this. Hopefully it doesn't get too confusing, but that is something that I see with a lot of people, that they get confused on, like injury codes and, well, they had surgery, so they don't have an injury no more. No. The reason that they had the surgery was because of the injury. So that's why that code has to be carried through. And only when they are healed, then do you use the Z09 in the history of injury or history of fracture code, depending on what they had. If they had a sprain, then they were coming back for a follow-up and everything's okay, and they're out of their treatment time and stuff, then, it would be Z09 with the history of injury for like a sprain. So something to think about. Okay. So future episode, yes. All right. And number 3 is medical coding isolating. Okay. So there is a lot of discussion about this. How should I phrase this? When you are in a hospital, depending on their space issue, because this happened at my facility where it was a space issue. They didn't have space for us in the clinic. In an older facility that, we moved into a newer facility, but at the old facility, there was no room for the coders. So they left us all out in this separate building, and we were in this box. I call it the box, with a bunch of bullpens in it, and or like cubicles, and it was 20 of us in this sardine can of a room, and I hated it. Now, don't get me wrong, it wasn't all bad, okay, but it did get to be overwhelming, because I like to work when it's quiet, but I also like to be very social. So it depends on what work environment you are in, okay? Now, I will say this before I go on. If you are a social person, you like to be talking to people, you like to be with people, don't get a job coding from home, because you're just going to be miserable. I mean, if you work from home, it is literally just you. I mean, you can connect with other people, like on Messenger and things like that. And I've talked about this before previously on some other videos. Essentially, you're by yourself. For some people, this works. Some people have a lot of nervous, they get nervous around people, and they, they just prefer to be at home by themselves and it's quiet, or they don't want to commute, or they don't want to dress up when they go to work. These, or they live far away. Okay. And sometimes, this works out better for some people. But if you like to be around people, if you like to get dressed up like I do, and you like to be social, like I like to be social, then try to find a place where you're going to be in working around your providers. When we were in the box, okay, they had us where we didn't really talk to the providers, and it wasn't until we moved into the new facility that we were literally embedded in the clinic, because they had literally made space for us in the clinic. That was one of their goals, was to have the coders close at hand, because they felt like that would be a better idea, which to me, yes, it is. It's brilliant. If you have your coder right there next to you, it's a lot better for communication. It's a lot better for the provider, that they can come to you at any time. There was a time in this new facility that I'm in, I was working with my providers, and we got separated for a little while because there was just a shift at work, and they did separate us. And it was hard for those providers. It was hard for me, because we had gotten so used to working together, and they were used to being able to come to me and ask me questions. I still allowed them to come and ask me questions, but it was because they didn't have the support at the time with the situation that we were all in. So, I mean, it just depends. And to me, if you're sitting there for an interview and you're asking, well, is this a place where I'm going to have to do a lot of education? Am I going to have a lot of contact with my providers? If it's important to you, let them know this is important to you. And sometimes maybe some people don't know if providers really want that, but it takes, the coder to go in and make the effort too. And like I said, I learned that the hard way. Dr. X, did teach me that. He was the one who I've mentioned him before quite a few times. That he's the reason that I really do talk to providers now, because I was scared. I was scared in the beginning. I was like, do they want to talk to me? Do they want to know anything I have to say? I don't know. And he's like, oh yes, I want to know if I can improve, if I can do something better, if I'm doing something wrong, tell me, And I was just like, okay, and I was like, oh, and now it's just like, ah, so, and now it's so much more better. And, if you, like I said, if you are very social, this is still a good field for people who are social, because we need good medical coders that are social, because there are a lot of really good coders that are very painfully shy and do not want to have any contact with providers. So if they're told they don't have to communicate with them, they are totally fine with it. To me, it would just be like taking the air out of my lungs. I wouldn't be able to handle it. I like to be around them. I like to talk to them. And even if it's just shooting them an email, I still try to make myself available, even by kind of like, I don't waste my time like walking around talking and things like that, but I do make it a point of like sticking my head in every once in a while and saying, hey, how you doing? I have a pulmonologist that I talk with quite often, and I will visit her. I will make it a point of visiting her at least once a month, because I know she's very busy, but she is very smart. And she's not used to a lot of hands-on with coders. So I kind of went in very slowly. I didn't want to, overwhelm her. But I do make it a point of going over there and just talking to her and, and sticking my head in and saying, hey, how you doing? And she'll say, oh, why you're here? And she'll start talking to me. So it's like, okay, So it's so much better. It works out really well if you are a social person. But make sure whatever environment that you're picking, that you pick an environment where you can be social. Okay, so that's something to keep in mind. But it's also, what is your attitude towards, wherever you're at. If you are in a isolated like office and you don't feel comfortable because you would rather be talking with providers, then find a position where you're going to be in that position to be able to be out in front and talking with providers. Because like I said, there are really good coders that don't want to talk to providers, so they kind of need a mouthpiece to have somebody to go and say, oh, I'm the liaison, and I'm talking because this I'm talking to you because this coder, is noticing this, and, how about if we talk about this? There is always that. So, and as you as you go along with medical coding, you may not have all the confidence in the world at first, but after a while it does start to get better, especially if you take the time to do your research, to make sure that you're studying, make sure that you're continuing to educate yourself as much as you can. That's the key. When you feel more educated, when you've learned something, or when you've taken the time to watch videos on YouTube like about surgeries and things like that, it is so much better for you. Okay? And I will continue to advocate that. I will always continue to advocate for good education and making sure that you are taking the time to learn as much as you can. Okay? But yes, and like I said, if you're very social, don't get a job working from home, because you're just going to be miserable. And if you're miserable in your environment, it's going to make you look at medical coding like you're the one who's making me miserable because I'm doing this job because of this. No, okay? Medical coding is a good field. It's fun. And to me, it's intellectually stimulating because I learn something new every day. I've been in the field for over a decade, and like I said, I'm still learning. So, and I will probably learn, continually, so. Yes, so that is my episode for today, for Q&A Tuesday. I'm getting long-winded, and I know it takes forever. This is going to take forever to upload. Sorry, guys. So anyway, I will be back for tomorrow's episode, so not to worry about the Z codes. I will do a whole episode on those. I may actually end up doing a series on the aftercare and the follow-up codes to try to make it a little bit easier to break it down. Okay, so if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right, I will see y'all tomorrow. Bye.